Mental Health on the Streets by Ashley,
Emily, and Taryn. What is our concern and why is it important? Our health concern deals with individuals that have mental health disorders. We looked at destigmatizing these individuals and getting help for them. Many of these individuals end up on the streets with a lack of care and assistance. We look at getting mental health professionals to help these people instead of the cops showing up and pressing charges on them. They are often intimidated by those in uniform, so they tend to act out more out of fear. If they are approached by professionals who are willing to help them, they have a much higher chance of cooperating with them. This topic is important because the individuals cannot control their mental health disorders, and we as people should work to help them and provide in any way that we can. We should not go straight to the cops when we have an issue with these people. Rather, we should call a mental health professional in an attempt to help them get the assistance that they are in need of.
Mental illness is very prevalent in American society. 1 in every 5 U.S. adults experience mental illness every year. 1 in 25 adults experience a serious mental illness each year. 1 in 6 U.S. youth aged 6 to 17 experience a mental health disorder annually, and suicide is the second leading cause of death among people aged 10 to 34. The prevalence of specific mental health illnesses in the United States is listed below. The most common is anxiety disorders, which affects 48 million adults, followed by major depressive episodes, which affects 17.7 million adults each year.
Mental illness by demographic groups. Mental illness affects all types of people regardless of race, gender, or beliefs. No one is alone in this, and always remember that you have someone to turn to. Demographics for U.S. children. 7.1% of children ages 13 to 17 years old, approximately 4.4 million, have diagnosed anxiety. 3.2% of children ages 3 to 17 years, approximately 1.9 million, have diagnosed depression. Demographics for U.S. adults. Non-Hispanic Asian, 14.7%, non-Hispanic white, 20.4%, non-Hispanic black or African American, 16.2%, non-Hispanic mixed multiracial, 26.8%, Hispanic or Latino, 16.9%, lesbian, gay, or bisexual, 37.4%. Effects of mental illness. Mental illness has impacts on individuals, families, communities, and the world. For a person, there's 19.3% of American adults with a mental illness also experienced substance abuse disorders in 2018. The rate of unemployment of the United States adults with mental illnesses is 5.8%, and that's greater than those without a mental illness, which is 3.8%. High school students with significant symptoms of depression are twice as likely to drop out compared to their peers. For families, it is estimated that 8.4 million people in the United States provide care to an adult with a mental illness. Caregivers of adults with mental illnesses spend on an average of 32 hours a week providing unpaid care. Some other effects of mental illnesses are on the communities. For communities, mental illnesses and substance abuse disorders account for 1 out of every 8 emergency department visits. Mood disorders are the most common cause of hospitalization for all people in the United States under 45 years of age. Serious mental illnesses cause $193.2 billion in lost earnings each year. 70.4% of youth and juvenile justice systems have a diagnosed mental illness. For the world, depression and anxiety disorders cost the global economy $1 trillion and a loss of productivity annually. Depression is the leading cause of disability worldwide.
The exact causes of mental illness are still being researched, but researchers believe that many conditions are caused by a combination of biological, psychological, and environmental factors. Biological factors that may contribute to developing a mental disorder include genetics, brain defects, prenatal damage, substance abuse, or other factors such as poor nutrition and exposure to toxins. Psychological factors that contribute to the development of mental disorders include severe psychological trauma suffered as a child, an important early loss such as the loss of a parent, neglect, and poor ability to relate to others. Environmental factors that may cause mental disorders include death or divorce, a dysfunctional family life, the changing of jobs or schools, social or cultural expectations, substance abuse by parents, or trauma faced later in life.
Mental health treatment. Average delay between onset of mental illness symptoms and treatment is 11 years. 43.3% of U.S. adults with mental illness received treatment in 2018. 64.1% of U.S. adults with severe mental illness received treatment in 2018. 50.6% of youth ages 16 to 17 with mental health disorder received treatment in 2016. Challenges and benefits of mental health treatments. Benefits. Several approaches to treating mental health disorders that can be tailored in a way to best help the individual. Increased sense of joy and contentment, decreased problems with everyday living, repaired and enhanced relationships, improved functioning at work. And challenges are 11.3% of U.S. adults with mental illness have no insurance coverage in 2018. 13.4% of U.S. adults with serious mental illness had no insurance coverage in 2018. 60% of U.S. counties do not have a single practicing psychiatrist.
The Public Health Initiative in our news story removed the police from 911 calls relating to people with a mental illness. This public health initiative tries to address many of the problems that can arise with mental health illnesses. Removing police from the scene can lower the amount of people who get arrested due to their mental illnesses. People suffering from a mental illness are not always in control of their actions, so this initiative allows them to receive the help they need to learn to control their actions. Individuals do not receive the same kind of help they need in prison. This initiative also allows and encourages people to seek professional psychiatric help. This can introduce people who are undiagnosed to resources that are available to them and increase their quality of life. The safety of other citizens is also improved. This program diverted approximately 17% of emergency calls, so police officers were able to respond to higher level emergencies.
Core public health function. This story falls under the assurance health function. It enforces laws and regulations by holding individuals responsible for their actions. It ensures provisions of healthcare services by connecting those who need counselors and psychiatrists the most to these resources and introducing them to other resources that are available. It ensures competent healthcare workforces by extensive training for mental health first responders. This initiative is still relatively new, but its effectiveness has been evaluated in the state of Colorado. Listed below are some core public health sciences that are addressed in this story. Behavioral science is the study of human behavior. The entire story discusses mental illnesses on the street. It is studied to help these people who are impacted. Research has helped the issues and hopefully will continue to help in the future. Health Services Administration is the direct operation of hospitals, health systems, and other types of organizations. The Denver Alliance for Street Health Response organization has been working hard to change how people receive help on the streets. Instead of police, medics come in casual attire to help. Instead of uniforms, people impacted with mental illnesses are now willing to accept help, unlike previous events. The U.S. Department of Health and Human Services statistics are used in this story. Statistics are given on mental illnesses and violence. A treatment advocacy center have statistics given for people who are in jail due to mental illness episodes on the streets.
The visual aid in our story is about a man named Matt Vanola. He struggles on a daily basis with mental health. Unfortunately, he lives on the street instead of his home because it is easier for him. Living on the streets is already an issue due to sanitation. Living in a more clean and healthy environment could help him become more stable.